Hi, I'm Rob Olson, a clinician scientist in the Department of Surgery in the Division of Radiation Oncology. Clinically, I work in Prince George at the BC Cancer Agency Centre for the North, where I treat head and neck cancers, lung cancers, and breast cancers. My research is focused on health services delivery research, predominantly in the setting of cancer care. My research program capitalizes on the rich network of data we have in BC, and most importantly, the provincial structure of the BC Cancer Agency's radiotherapy program. As the sole provider of radiotherapy, we have population-level access to data. As an example of my population-based health services delivery research, I lead the Provincial Prospective Outcomes and Support Initiative, referred to as POSI. This research program is innovating the way we deliver cancer care, guided by electronic capture of patient-reported outcomes. Since starting, POSI has collected patient-reported outcomes from over 5,000 patient encounters, and is expanding at an exponential growth. This program will fuel research focused on patients' report of their experience, symptoms, side effects, and more. An example of research that is possible through our program is comparison of patient-reported outcomes by different radiotherapy prescriptions. Despite evidence from randomized control trials that a single moderate dose of radiotherapy is as effective as a course of 5 to 10 smaller doses, there is variable use of a single fraction in BC and internationally. The use of a single dose varies between 1/4 to 3/4 depending on which center a patient is treated at in BC. One of the reasons for low use of a single dose is that most of the randomized control trials excluded patients who had poor performance status or bone metastases that are complicated by a fracture or neurological compromise, such as a spinal cord compression. Therefore, we wanted to compare patients reported their outcomes between a single treatment versus a 1-week course using data from POSI. Importantly, we had the opportunity to include all types of patients who present to the BC Cancer Agency, including those with poor performance status or bone metastases complicated by fracture or neurological compromise. Using POSI data, we found that rates of partial or complete response to radiotherapy were similar whether either a single treatment or a week-long course were used. Function and quality of life level improvements were also similar between both. However, when we restricted the analysis to those with complicated bone metastases, the complete response rate and the functional improvement post-radiotherapy was better in the group who received the week-long course of radiation. This research has led to increased prescription of a single radiation dose for bone metastases in BC, though it also supports the use of a higher dose, week-long course in certain circumstances. The cost savings in BC are substantial, especially considering the cost of patients traveling to receive treatment. This research has been widely publicized in America, where the cost savings could approach $500 million annually. The impact of knowledge translation from this research is not limited to cost savings alone. Because oncologists are prescribing more single fraction treatments, wait times have now reduced as treatment spots open up for other patients. I would like to thank the department for this recognition and my many collaborators.